Thank you, Governor. By the way, I did ask for my absentee ballot last week, so I just want you to know that. COVID has forced a lot of difficult decisions. We've been trying to balance and have tried to balance public health and safety versus business versus a lot of different things. And we've learned as we've gone through. So with this learning, we are going to put into place and have filed some emergency regulations around childcare today. So we recognize it's been a difficult time for childcare providers, for parents, and we want to make sure that we support the adequate capacity and access to childcare. But this has been a learning process. When we started, we learned a lot about COVID. We know a lot more than we did when we began. As childcare providers, we've learned a lot about how to get children in and out of facilities and what it means to have them in groups. We've learned the importance of masks and wearing them at all times. We've learned the importance of social distancing. So there are many, many things that we've learned. And as we've learned, I think we've also learned, and we see through the General Assembly, we now understand the importance of childcare, how important it is for parents to have a place so that they can go back to work. So with this, we know that capacity and childcare deserts existed across Kentucky prior to COVID, and what COVID has done is exacerbated those very deserts. So what we're offering today is a comprehensive approach. We know that we need to support additional capacity. We know we need to support additional access across the Commonwealth, and we know, as the governor referred to in harm reduction, we have to be able and will enforce the child care regulations as they're written. So we want to acknowledge first, we know parents are coming together in pods to work on NTI, the non-traditional instruction. And as folks come together with that, we want to provide some guidance. You know, we think that it's important. Regulated childcare is very important because we know that there are childcare background checks. We know we can enforce the masking and things of that nature. So we're going to make some suggestions. It's better to be outside. It's better to wear a mask. You have to wear a mask. The group sizes are very important. But as people begin this non-traditional instruction, we also know that in the whole continuum of childcare in Kentucky, we have very, very few of those smaller providers, those registered and certified providers. And what we hope is that people, as they experience this NTI and this working together, that they may want to become registered or certified childcare providers. So we're going to provide some funding and some support to get those folks registered and certified as ongoing childcare providers. We're going to learn whether this makes a difference and whether this is helpful, and we hope that it is, because we need more folks to participate in those smaller size childcare experiences. So we're going to make sure that we accelerate certification and registration. We're going to provide about $2,500 to help people start up. And this, we hope, leads us to an understanding of how to support folks and better understand how to support folks to become registered and certified providers. Another group that has been really heroes used too often, but has been so helpful as we began the reopening of childcare and knew that we had to support our essential health workers. Places like the YMCA, who became limited duration centers. We know some of them have transitioned to licensed childcare, and we want to support that as well. So we're going to allow those limited duration centers an opportunity to function for another 90 days, and then to come into licensure. And again, we'll support them with accelerated licensure, with consultation to get them to full licensure. And we expect them to. And even employers who may want to provide childcare for their employees, we're giving you an on-ramp to become licensed childcare providers. And we will support you through that process. And finally, the other thing that we are doing is that we are increasing the group size from 10 to 15. We know we're at a plateau. We've seen our positivity rate begin to decline. We think that this is an important step, as we have all learned together the best way to cohort, the importance of masks, the importance of social distancing, and we've learned how to do that. So with that, we want to make sure that we support those group size. We're going to allow some very limited tours for parents. That's been a concern through the child care providers. We're going to continue with our All Stars program to continue to support quality child care. And we're going to allow, instead of the fingerprint background checks, because you know that is still a challenge across the Commonwealth, some name-based background checks. So, supporting NTI to move towards, if possible, registered and certified. Some ideas about how to do that moving forward and some support. Those folks, as you referenced, that are providing this NTI for reimbursement and advertising, we're going to enforce the child care regulations. And those folks will either need to close or need to come into licensure. We're offering that path. So we want to support and continue to support child care providers. We did it with the initial CARES funding. We're going to continue to do it with CARES funds. And so we hope that this is a relief to providers, a relief to parents, and a way that we can increase capacity in not just one way, but in a variety of ways, so we can address the entire continuum. Thank you.